5 health risks of chronic heavy drinking. Are you a chronic heavy drinker, or do you know someone who is? Drinking too much harms your health and has caused tens of thousands of deaths in the U.S. over several years. Further, excessive drinking is responsible for 1 in 10 deaths among working-age adults aged 20 to 64. This data and countless others have shown time and time again the perilous effects of excessive alcohol consumption. And it's about time you know what can happen if you or someone you know continues to drink heavily. Let us now begin our list of the 5 health risks for chronic heavy drinking, which can happen to both men and women who drink excessively. 1. Increased risk for cancer. Chronic heavy drinking can increase your risk for certain types of cancer. Why? Because when you consume alcohol, your body converts it to acetaldehyde, which is a carcinogen. Alcohol has been studied to increase the likelihood of 6 specific cancers, which are cancers of the breast, liver, esophagus, mouth, larynx or voice box, and pharynx or throat. It is also known to increase the risk of colorectal cancers. 2. Cardiovascular diseases. Heavy drinking increases your risk for stroke and heart disease. It leads to high blood pressure or hypertension, which can cause chronic disease such as heart disease. Alcohol also raises the levels of fat in the blood, further increasing blood pressure. Other cardiovascular complications of drinking alcohol are heart rhythm abnormalities and cardiomyopathy, which is the weakening of the heart muscle. 3. Cirrhosis. Cirrhosis is the most advanced form of liver disease caused by alcohol. Some of the symptoms include jaundice, skin itching, and portal hypertension, which is the increase in blood pressure in the vein. Alcohol causes inflammation of the liver and causes scarring of the liver tissues. The liver is responsible for filtering the blood of toxins and creating bile to help absorb fat. When scarring occurs, the liver can no longer function properly. 4. Pancreatis. Chronic heavy drinking is the top risk factor for chronic pancreatitis. It is a dangerous condition wherein the pancreas is inflamed due to excessive alcohol consumption. The symptoms of pancreatitis include nausea, vomiting, acute abdominal pain, increased heart rate, back pain, low-grade fever, and the malabsorption of nutrients in the body. It is a painful disease that occurs suddenly and lasts for a matter of days. For every 3 cases of pancreatitis in the U.S., 1 is caused by excessive alcohol drinking. 5. Alcohol-related dementia and depression. Aside from the risk to physical health, heavy drinking can also cause mental health issues like dementia and depression. The short-term effects of alcohol mirror the symptoms of dementia, such as memory loss, poor judgment, and difficulty in decision-making. It can also lead to violence and suicidal tendencies. Though many people drink because they are depressed, studies have shown that chronic drinking furthers the symptoms of depression and is associated with suicidal tendencies, irritability, changes in behavior, and struggles with daily tasks.